This is a short video on the elegance of a unitary device. This is the two-pass minimal touch technique with the Venapax system. Dissect 2 to 3 millimeters off the vein to preserve the adventitia and perivascular tissue. Get your blades out early. Use the blades to seal and cut the adventitia on both sides. Make sure you leave the adventitia and the perivascular tissue intact. You want to move posteriorly. I like to corkscrew the conical tip to reduce shearing. My force is at the bottom of the tunnel on the posterior fascia, not the vein. And you're trying to leave as much adventitia as you can. Once the posterior pass is done, you switch to the anterior pass. Dissect and ligate branches distally. Always keep the conical tip with the score in between the blades and the vein. Employ a 10 o'clock, 2 o'clock technique during the anterior pass. Window, retreat, elevate, cauterize, and cut. So I window, I retreat, I elevate that adventitia with the conical tip, and then use my bipolar cautery to seal and cut the adventitia and the branches. Simply repeat. I switch to the other side, I window, I retreat, I elevate the adventitia, cauterize, and cut. Continue to leave all the adventitia and as much perivascular tissue as you can. Continue to employ the 10 o'clock, 2 o'clock technique, having your conical tip and the bipolar cautery accessible at all times makes the unitary device incredibly efficient. Always working in 2-inch increments during the anterior pass, window, retreat, elevate, cauterize, and cut. When finished, you'll have a beautiful conduit with all the adventitia, perivascular tissue intact to feed this living organ you're going to place on the heart as a new graft.